Hey guys, I am Sunita Komarshetty. Hope you all are doing well. Today we have Dr. Isha Soni to answer few of our questions about autism in children. First of all, thanks for joining us, Dr. Isha Soni ji.
I'm Dr. Isha Soni, a senior occupational therapist and center head at Lexicon Rainbow Therapy and Child Development Center, Pune. After graduating from KEM Hospital, Mumbai, I continued doing multiple certification courses from abroad to make these approaches accessible for our Indian children. I have been certified in sensory integration therapy from University of Southern California, decoding autism, handwriting without tears, social thinking program, and brain gym. As I started my graduation course, I had more inclination towards pediatrics as I loved children. While I was studying, autism was relatively known but unclear concept. The curious learner in me took it as a challenge to travel this untreaded path and pursued multiple workshops and certifications to get trained from the clinical stalwarts and neuroscientists. Autism isn't so easy to understand as a novice, but the best teacher for me is a child. I have had immense learning from every child on my caseload, as every autistic child is different. No two autistic children are the same. My interest in autism led me to co-author a research paper during the pandemic, which got published in 2022 on video-based screening for children with suspected autism spectrum disorders. Autism and SI is my forte, and I love to work and understand the neurodivergent thinking. Autism is a neurodevelopmental condition seen in children characterized by speech delay, communication difficulties, restricted interests, repetitive behavior, social skills difficulty, and sensory processing challenges. It is a spectrum disorder where every child is affected differently in various domains like social, speech and communication, motor and cognition. The current incidence is 1 in 36 children as stated by Center for Disease Control for surveillance year 2020. So, the symptoms typically appear in early childhood and are evident around age 18 to 24 months. The earliest signs being speech delay, no social smile, not responding to his name, and limited eye contact. All these milestones are typically achieved and mastered by a neurotypical child by age 1 year. Other signs may manifest as not addressing parents as mama, papa, not saying two-word phrases by age 2 years like papa bye-bye, mama water, not using non-verbal gestures like waving a bye or showing by pointing, not showing shared interests, has sensory sensitivities to touch, sound or movement, and sometimes fascinated by spinning objects. Parents must get concerned about these missing speech and social milestones and consult their pediatrician. The pediatrician would then evaluate the child and suggest further course of action, usually a referral to a developmental psychologist who administers certain standardized paper pencil tests and caregiver questionnaires. If the clinician feels and the child tests as being at risk for autism, parents should immediately start with the early intervention. In 2023, the CDC reported that around 1 in 36 children in the US is diagnosed with autism. Autism prevalence has increased 178% since 2000. Autism is more common in boys than girls. Research from 2021 found that autism is about 4.2 times more prevalent in boys than girls. This means that for every girl with autism, there are 4 boys with autism. There has been some debate over whether the prevalence of autism has increased in recent years. Some studies have suggested that there has been an increase in the number of children diagnosed with autism over the past few decades, but it's important to note that this increase may be due to part to changes in diagnostic criteria and increased awareness of the condition. In the past, autism was often misdiagnosed or undiagnosed altogether. However, with greater awareness and understanding of the condition, more children are now being diagnosed and receiving appropriate support and services. Additionally, changes in diagnostic criteria over time have expanded the definition of autism and made it easier to diagnose. Also, there may be other factors that contribute to the apparent increase in autism prevalence, such as changes in environmental or genetic factors. There has been some speculation that changes in environmental factors such as increased use of technology or exposure to certain chemicals may be contributing to the apparent increase in autism prevalence. However, more research is needed to fully understand the causes of autism and the factors that contribute to its prevalence. Autistic kids have difficulty with social communication and interaction. They may struggle with understanding social cues such as facial expressions, body language, and tone of voice. They may also have difficulty initiating and maintaining conversations, making eye contact, and understanding social norms. Another one being difficulty with social imagination. They may have difficulty understanding or predicting the thoughts, feelings, or actions of others, which can make social situations confusing or overwhelming. This may come across sometimes as being rude, but it's actually due to a social difficulty. They may have difficulty taking turns in conversation, sharing interests, or responding appropriately to social cues. Many children with autism have sensory sensitivities which can make social situations uncomfortable or overwhelming, like attending a birthday party or going to a mall. They may find it overwhelming due to sensory overload of too many people and loud sounds. They may be sensitive to certain textures or smells and may not like to eat outside snacks served in the party, which can make it difficult to participate in social situations. The academic challenges that a child faces is difficulty with language and communication. Children with autism may struggle with language and communication, which can make it difficult to participate in classroom discussions, understand instructions, or complete written assignments. Difficulty with integrating sensory information can impact their ability to focus in the classroom. They may be distracted by sounds, lights, or other sensory input. They may also struggle with academic tasks such as reading, writing, and math. They may have difficulty understanding abstract concepts, applying knowledge to new situations, or organizing their thoughts in writing. Autistic children also show difficulty with transitions. They may have difficulty transitioning between activities or subjects in the classroom. They may need extra support to make transitions, such as visual schedules or verbal cues. Another challenge is difficulty with executive functions. Executive function is a cognitive process that allows us to plan, organize, and complete tasks. Many autistic children struggle with executive function, which can impact their ability to stay on a task, manage time, and complete assignments. Autistic children also have difficulty with sensory processing. It is the ability of our brain to interpret and respond to sensory input. This can make it difficult to focus in the classroom or complete assignments that require sustained attention. Despite these significant challenges, with the right supports and accommodations, autistic children can often succeed academically and socially. Teachers and parents can work together to identify the specific challenges that a child with autism may be facing and develop individualized strategies to support their learning and growth. The first step is acceptance. If we don't accept a child's difference, nobody will. If we don't understand a child, nobody else will. If we don't support our child, nobody else will. If we stigmatize our child, everybody else will. We live in a society formed by us. All are different and each one of us has our own set of strengths and weakness. One of the few things that a parent can do is to create a structured environment. Autistic children often thrive in a structured environment, so it's important to establish a routine and stick to it as much as possible. This can include scheduled meal times, designated homework time, and consistent bedtimes. Next, a parent can do is provide sensory stimulation. Mostly, autistic children have sensory processing difficulties and are sensitive to sensory input. So, it's important to provide appropriate sensory stimulation. This can include things like weighted blankets, fidget toys, or noise-cancelling headphones. Another very important step is to communicate clearly. Autistic children may struggle with language and communication. So, it's important to communicate clearly and directly. Use simple language and avoid idioms or metaphors, which can be confusing. Parents can also use visual aids. They can be very helpful for autistic children as they often process information better through pictures and diagrams than through spoken or written language. This can include things like picture schedules or visual timers. Parents must encourage social interaction. Many autistic children struggle with social interaction, so it's important to encourage socialization in a safe and supportive environment. This can include setting up play dates with other children or joining a social skills group. Another thing that parents can do is to celebrate strengths. Autistic children often have unique strengths and talents. So, it's important to celebrate and encourage these strengths. This can help build self-esteem and confidence. Finally, it's important to seek professional help if needed. This can include working with a therapist or counselor who specializes in autism or consulting with a pediatrician or other healthcare provider. They can provide guidance and support to help parents better understand and meet the needs of their autistic child. There is a lot of misinformation about the lesser known childhood development issues, autism being one of them. The probable reason for it is the condition having no cure. In this scenario, parents often end up experimenting various unknown therapies or approaches on their child with the hope of cure. This can also prove to be fatal at times. Parents must always go ahead with evidence-based practices. These are an approach that have been researched on a larger population and has shown positive outcomes in autistic children. The first such evidence-based practice is applied behavior analysis, also known as ABA. It is a type of therapy that focuses on identifying and modifying specific behaviors. It is often used to help children with autism develop new skills and reduce problem behaviors. ABA is based on the principles of reinforcement and uses positive reinforcement to encourage desired behaviors. Next is speech and language therapy. Many children with autism have difficulty with language and communication, and speech and language therapy can be very helpful in improving these skills. Speech therapy may focus on improving communication skills such as using language to interact with others or on improving speech production. They also use picture exchange communication system known as PECS to teach functional communication skills and promote language development in autistic children with no or limited speech in a social context. Another very important therapy is occupational therapy. OT can be helpful for autistic children who have difficulty with fine motor skills, sensory processing, or activities of daily living. Occupational therapists may work with children to improve hand-eye coordination, sensory integration, or self-care skills. Social skills trainings can be helpful in improving these skills. Social skills training may involve activities that help children learn how to initiate and maintain conversations, read social cues, or engage in group activities. Sensory integration therapy is useful for autistic children having sensory processing difficulties, and it helps children learn to process and respond appropriately to sensory input. Many times, cognitive behavioral therapy is used with autistic children. It focuses on changing negative thoughts and behaviors. It can be helpful for children who have anxiety, depression, or other mental health concerns. CBT may involve teaching children coping skills, relaxation techniques, and cognitive restructuring. A very key therapy is the parent training. Now, this is helpful for parents of children with autism as it can provide them with skills and knowledge they need to support their child's development. Parent training may involve strategies for managing problem behaviors, teaching new skills, and promoting communication and socialization. Assistive technology such as visual schedules or communication devices can be helpful for children with autism who have difficulty with communication, sensory processing, or organization. Assistive technology can be customized to meet the specific needs of each child and can be a valuable tool for improving communication and reducing problem behaviors. It's important to note that every child with autism is unique, and what works for one child may not work for another. It's also important to work with trained professionals to develop an individualized treatment plan that meets the specific needs of your child. With appropriate interventions and support, children with autism can make significant progress and achieve their full potential. So what is early intervention? It refers to services and therapies that are provided to children with autism at a young age, typically before the age of 3. Early intervention can be very effective in improving outcomes for autistic children as it can help them to develop new skills and reduce problem behaviors. Typically, speech therapy, occupational therapy, and ABA are included in the early intervention programs. The sooner, the better. The same is applicable for autism too. Parents must seek help from the right professional the moment they suspect any form of delay in their growing child. All delays are not autism. There are multiple causes of childhood developmental delays. If the parents visit a developmental pediatrician as soon as they notice any early signs, they will be guided accordingly for therapies, early intervention which can prove very beneficial for their child. Acceptance from parents and the child's family is of utmost importance for them to take an action. Many families stay in denial for a very long time, wasting the child's important window period of growth and maximal response to therapy. Humans are much tamed to form habits. Similarly, if a negative behavior is not nipped in the bud, it becomes very difficult for therapists and parents to eliminate it later. Consulting a psychologist can be a helpful step in identifying and addressing potential learning difficulties or developmental challenges such as autism. Psychologists are trained to assess and diagnose a wide range of developmental, behavioral, and emotional disorders and can provide recommendations for appropriate interventions and support. When a child is struggling academically, it's important to consider whether there may be underlying learning difficulties or developmental challenges that are contributing to the difficulties. For example, children with autism may have difficulty with social communication and may struggle with tasks that require executive functioning skills, such as planning and organization. These difficulties can impact their ability to perform well in academic tasks, such as writing or completing assignments. A psychologist can conduct a comprehensive evaluation to assess the child's strengths and challenges, identify any learning difficulties or developmental challenges, and develop a plan for appropriate interventions and support. Depending on the results of the evaluation, the psychologist may recommend additional assessments such as speech and language therapy evaluations or occupational therapy evaluations to further explore the child's needs. Teachers, parents, healthcare providers and other professionals are also involved in developing a plan to support the child's academic and developmental needs. By working together, we can ensure that children with learning difficulties or developmental challenges receive the support and resources they need to reach their full potential. Yes, there are several misconceptions about autism that persist in our society. The first one being that autism is caused by bad parenting or childhood experiences. This is a common myth that has been debunked by research. Autism is a neurological condition that has a genetic component and is not caused by parenting or childhood experiences. Second is that all people with autism are the same. Autism is a spectrum disorder, which means that it affects each person differently. Some people with autism may have difficulty with social communication and interaction, while others may have sensory processing difficulties or repetitive behaviors. Another one is that people with autism lack empathy. This is a harmful stereotype that is not true. While people with autism may have difficulty with social communication, they are capable of experiencing empathy and forming meaningful relationships. Many people claim to cure autism. There is no cure for it, but early intervention and support can help individuals with autism develop skills and strategies to improve their functioning and quality of life. Another myth is that people with autism are not able to live independently or have successful careers. This is not true. While some individuals with autism may require support and accommodations, many are able to live independently, have successful careers, and contribute to their communities in meaningful ways. It's important to recognize that people with autism are individuals with unique strengths and challenges. By understanding and accepting these differences, we can create a more inclusive and supportive society for people with autism and their families. Another myth is that communication is a complex issue in autism. While some individuals may have difficulty with verbal communication, others may have extensive vocabularies and strong language skills. Additionally, some individuals with autism may rely on non-verbal communication such as gestures or facial expressions to communicate. People with autism have diverse interests and abilities. Just like anyone else, they have a wide range of interests and abilities. Some may have exceptional talents in areas such as music, art, or mathematics, while others may have strengths in areas such as problem solving or attention to detail.